I wish I knew. I wish I bought bundles. I wish I checked it from my friend's phone. Those will be your words after finding yourself in a mess for failing to follow up to our online education. Guys, welcome back to our day-to-day online education. And may I start by thanking you people for the support you are showing this channel. Currently we are at 8.7 thousand subscribers. Road to 10,000 subscribers. Don't be left behind. Don't regret later. The time is now. Subscribe, like, share and follow our education, and you will benefit from it. Let's get back to our topic which we started yesterday about peuperal sepsis, and today we are going to ask ourselves one question. How are peuperal sepsis infection caused? How are they caused? Here, an intact uterus or before delivery. An intact uterus is always considered sterile. This means it's always free from infections. However, bacteria that live on the skin, for example, streptococcus and streptococci, and other bacteria can still cause infection by invading the damaged skin or tissue. These bacteria thrive in moist, warm environment or lower abdomen. The key word here is moist, warm environment of the lower abdomen. Obvious, after delivery, the lower abdomen will be moist. So this is where these bacteria will thrive 100%. Postpartum infection can start in uterus after the mother water breaks, or what we call the rupture of membranes. Uterus can also become infected if the amniotic sac and fluid become infected. Definitely, any infection around the uterus will cause or will lead to peuperal sepsis or peuperal infection or postpartum infection. Amniotic, for those who don't know, amniotic sac is the membrane that contains fetus, or where the fetus grows in the womb, and the amniotic fluid. Another question: what are the risk factors? What are the risk factors or factors that can predispose one or a mother to peuperal sepsis? Obviously, this infection affects mothers, not males. So, what are the risk factors to developing a postpartum infection? Here, your risk of developing an infection after your delivery differs depending on the method used to deliver your baby. So the risk depends on the method that has been used to deliver your baby. I hope we are together, guys. So, your chance of contracting an infection is number 1, 1 to 3% or standard vaginal deliveries. So 1 to 3% of standard normal vaginal deliveries gives a chance for a mother to contract an infection, and this may also depend on the place where the mother is delivering. So obviously, if the environment where she is delivering is dirty, she is going to contract infection after normal or standard vaginal delivery. Number 2, 5 to 15% of scheduled or planned cesarean section deliveries performed before labor begins. So this percentage can predispose or is a risk factor to one contracting postpartum infection. Number 3, 15 to 20% of non-scheduled or non-planned cesarean section deliveries performed after labor begins. Labor might begin, and due to unavoidable circumstances, for example, the mother may have no enough maternal powers to push the baby out. This may lead to an unplanned cesarean section. So this can risk the mother into getting an infection because there must be an opening on the incision site. As we continue, an added risk may include, an added risk to this postpartum infection may include females with no previous pregnancy and extremes in age. Females with no previous pregnancy or those who have never delivered, and extremes in age or big age. For example, very young or older, very young or older. So, prior medical conditions or previous medical condition. You might have a condition that might predispose you to a postpartum infection after delivery. For example, you may be having anemia or low blood count. You might be having obesity. You might be having diabetes. You might be having high blood pressure, and also immune system problems may also or may lead to the chance of an infection or may risk you to getting a postpartum infection. Other factors that can lead to a postpartum infection include: number 1, multiple vaginal examinations. So when you are in an hospital, you may find some doctors or some nurses are doing the vaginal examinations unnecessary. Depending on how clean his or her hands are, it might infect or contract or risk you at getting a postpartum infection. Number 2, monitoring fetus inside the uterus. Monitoring fetus inside the uterus. Number 3, delay between the amniotic sac rupture and the delivery, or what we call prolonged labor. So this delay may predispose the mother in contracting an infection because he or she is in an hospital setup and maybe the environment might be dirty, so she will get what we call the ascending infection after the rupture of membranes, and then after membranes are ruptured, if it takes long for the baby to come out, this prolonged period might dispose one to getting this kind of infection. Number 4, manual removal of the placenta. You might have a retained placenta and the doctor decide to remove it manually. Depending on the cleanliness of his hands or the gloves he or she is using, if they are dirty, obvious, she will take bacteria inside your uterus and might predispose you to peuperal sepsis or postpartum infection. Number 5, having remains of placenta in the uterus after delivery. If these remains are there trapped in the placenta, they might start decomposing, and this predisposes the uterus to an infection. Number 6, excessive bleeding after delivery. This may lead to what we call ascending infection, as bacteria love blood. So wherever there is blood, there is a risk of an infection. So excessive bleeding can lead to a postpartum infection or peuperal sepsis. Next point, baby stool found in amniotic fluid. This stool is not clean, so it might predispose the uterus into getting an infection. Number 8, use of a catheter to soften the opening of the uterus. The catheter, part of it is outside, part of it is inside, so bacteria can climb up following the catheter to inside your uterus and predispose you to postpartum infection. So other infections or conditions that may lead to a postpartum infection include, so we have other infections that the patient might have that may lead to a postpartum infection. For example, sexually transmitted infections. For this, we discussed in deep, and I know, guys, you understand what I mean. Another point, we have overgrowth of a bad bacteria invasion. Overgrowth of a bad bacteria invasion in the vagina. Obvious, when bacteria is there, it's an infection already. The last point, we have what we call group B streptococcus. Group B streptococcus, all bacteria living in the vaginal tract. This might also predispose one to getting a postpartum infection or peuperal sepsis. This marks the end of our discussion, or the end of our first video, and let's meet in the next video, whereby we will continue with the same topic. Guys, let's continue subscribing, liking our videos, and let's not forget to share with our friends so that this channel may grow greater and greater. Have a nice evening.